Ever wondered what the early signs of pregnancy could look like? It's a question that piques the curiosity of many, and for good reason. Recognizing early pregnancy symptoms is crucial, as it allows for timely prenatal care and lifestyle adjustments to ensure a healthy pregnancy journey. However, it's important to understand that these symptoms can vary greatly from woman to woman. Some may experience a myriad of signs, while others may not notice any at all. This variability is perfectly normal, reflecting the unique ways our bodies respond to the complex process of creating new life. That's why we're here today, to guide you through the extensive array of possible early pregnancy symptoms. We'll delve into each one, providing insights that can help you understand the changes happening within your body. So, whether you're planning for a baby or simply want to be informed, this guide is for you. Stay tuned to understand the possible early signs of pregnancy. The most common sign of pregnancy is a missed period. A woman's body follows a regular cycle, where every month it prepares for a possible pregnancy. If a woman's egg isn't fertilized, then the lining of the uterus, which thickened in anticipation of a pregnancy, sheds away. This shedding is what we refer to as a period. Now, if a period is missed, it might mean that the egg has been fertilized and the body is preparing to support a pregnancy. But it's important to remember that a missed period doesn't always mean pregnancy. Stress, for example, can disrupt the regularity of the menstrual cycle, as can significant changes in weight. So while a missed period could be an early sign of pregnancy, it's not a definitive one. It's always best to consult a healthcare professional or take a pregnancy test if you're unsure. A missed period is often the first hint of pregnancy, but it's not a definitive sign. Morning sickness, despite its name, can strike at any time of the day. It's one of those early pregnancy symptoms that can feel both bewildering and yet somewhat reassuring. But why does this happen? Well, it's largely due to the hormonal changes your body is going through. Particularly, there's a surge in the hormone called human chorionic gonadotropin, or HCG for short, which is produced after the egg attaches to the uterine lining. This hormonal surge can lead to feelings of nausea, and yes, the dreaded vomiting. Some women may start experiencing these symptoms as early as 2 weeks after conception. It's important to remember, though, that every woman's body is unique. Some might not experience morning sickness at all, while others may feel it intensely. So don't fret if your experience doesn't match the typical narrative. Morning sickness can be one of the earliest indicators of pregnancy. Changes in your breasts can also signal pregnancy. Here's why. From the very early stages of pregnancy, your body begins to go through a series of hormonal shifts. One of the most immediate effects of these changes is often a newfound tenderness or soreness in the breasts. You might notice this even before you've missed a period. Furthermore, these hormonal changes can affect the appearance of your breasts. The areolas, the dark circles around your nipples, may start to darken even more. This is due to an increase in melanin, the pigment that gives your skin its color. In addition to this, you may notice that the veins on your breasts become more visible, giving your breasts a slightly bluer appearance. It's important to note that while these changes can also occur before a menstrual cycle, they tend to be more pronounced during pregnancy. So, if you're noticing these changes, it might be worth taking a pregnancy test. Though these changes can also occur before a menstrual cycle, they are more pronounced in pregnancy. Feeling unusually tired? It could be an early sign of pregnancy. Fatigue is a common symptom in the early stages of pregnancy, and there's a biological explanation for it. The hormone progesterone, which skyrockets during early pregnancy, can make you feel as if you've run a marathon when all you've done is put in a day at the office. It's a powerful hormone that helps maintain the uterine lining and prepare the body for a potential baby. But remember, fatigue can also be influenced by many other factors. Stress, depression, and common illnesses can all contribute to a feeling of tiredness. So if you're feeling more tired than usual, it's worth considering all possible explanations. It's also important to know that not every woman will experience fatigue during early pregnancy. So while you might be feeling more tired than usual, don't jump to conclusions. Fatigue alone isn't a definite sign of pregnancy, but it can be one of the first symptoms you notice. Frequent trips to the bathroom might be more than just a small bladder. When it comes to early pregnancy, increased urination is a common symptom. But why is that? Well, it all comes down to hormonal changes. As your body prepares to support a new life, it releases a hormone called human chorionic gonadotropin, or HCG for short. This hormone, among other things, increases blood flow to your kidneys, which in turn leads to more urine production. It's like your body's way of making room for the baby. This symptom typically begins 6 to 8 weeks after conception. So if you find yourself running to the bathroom more often than usual, it might be worth taking a pregnancy test. However, keep in mind that frequent urination is not exclusive to pregnancy. It's also a common symptom of urinary tract infections and diabetes. Increased urination can be an early sign of pregnancy, but it's also common in urinary tract infections and diabetes. Suddenly craving pickles and ice cream? It could be a sign of pregnancy. A sudden hankering for a certain food or drink, or a sudden distaste for your favorite meal, might actually be your body signaling a big change. Hormonal changes, specifically the rise in levels of human chorionic gonadotropin, can trigger these cravings or aversions. They can occur at any time during pregnancy and can vary widely from woman to woman. Some women may find themselves craving salty foods like chips or pickles, while others might crave sweet treats like ice cream or chocolate. Conversely, some women may find that foods they once enjoyed now make them feel nauseous or even repulsed. It's important to note, though, that cravings or aversions aren't exclusive to pregnancy. They can also be caused by stress, dietary deficiencies, or even just your mind playing tricks on you. While food cravings or aversions can be a sign of pregnancy, they can also be caused by other factors. Remember, every woman's experience with early pregnancy can be different. Just as no two snowflakes are alike, so too are the experiences of women when it comes to the signs of early pregnancy. We've journeyed through the common indicators, beginning with the missed period, often the first sign that makes a woman wonder if she's expecting. We delved into the world of nausea and vomiting, commonly known as morning sickness, a symptom that can strike at any time of the day, not just the morning. We also discussed the changes in the breast area, including tenderness, swelling, and even a darkening of the areolas. Fatigue, that overwhelming sense of tiredness that seems to come out of nowhere, was our next stop. It's a sign that your body is hard at work creating a new life. We also touched upon the increased frequency of urination, a symptom brought on by the increasing amount of blood in your system. And finally, we explored the fascinating realm of food cravings and aversions. You might find yourself repulsed by foods you once loved, or craving foods you've never given a second thought before. While these signs can be indicators of pregnancy, it's crucial to remember that they can also be symptoms of other conditions, or even just the normal changes your body goes through every month. A pregnancy test is the most reliable way to confirm if you're pregnant. These tests work by detecting a hormone called human chorionic gonadotropin, HCG, which is produced in large amounts when you're pregnant. If you think you might be pregnant, take a home pregnancy test and consult with a healthcare provider. It's important to receive prenatal care as early as possible to ensure the health of both you and your baby. Never hesitate to seek advice and support. You're not alone on this journey. There's a whole community here to help. Until next time, take care of yourself. Please do not forget to share, subscribe, and comment.